My name is Aprana Atluru, and I'm a medical student here at Texas Tech in El Paso. So I'm originally from Houston, but I've been here for the last 3 years. And I'm a fourth-year medical student, and I'm going to be applying in psychiatry. So I'm very interested in psychiatry, and I became involved in this project basically with Dr. Liner because I was looking for a psychiatric cross-cultural project. And so in the project, we investigated, basically our objective was to see if there was an effect of collective violence on children living under the poverty level. And we investigated both Ciudad Juarez and El Paso in the years 2007 and 2010. And so in 2007, I guess that was kind of before all of the collective violence had precipitated. And so basically in our outcomes, we found that children that were exposed to collective violence, which would be the children in Ciudad Juarez versus children who were not exposed to collective violence, which would be the children in El Paso, the children that were exposed ended up having lots of psychiatric and emotional problems measured by different scales such as anxiety, depression, somatic complaints, and various other psychiatric and psychological problems. And since there is such a shortage in psychiatric care, as well as the lack of acknowledgement of psychiatric problems, both on the Mexico side of the border as well as on the United States side, we found that it is a very real phenomenon that the violence in Ciudad Juarez does have a very significant psychological and psychiatric impact on those children, and psychiatric help is necessary both over there as well as over here, but it's just important to acknowledge that that is a necessity and try to address that problem. They were children between the ages of 6 and 18. We used the child behavioral checklist, which basically it's a self-response type of questionnaire, and has various indices like depression, anxiety, and different scales that, based on the questions they answer, we'd be able to figure out which psychiatric problem they have or which scales they're normal within normal limits. Collective violence meaning kind of like a societal violence, specifically in this case attributed to the organized crime in Ciudad Juarez. Okay. So we just found that there was, within the various indices which are part of the child behavioral checklist, between 2007 and 2010 in Ciudad Juarez, there was a significant worsening in nearly all of the emotional problems that were accounted for in the child behavioral checklist, whereas on the United States side, there were not any significant statistical changes in those numbers. In both 2007 and 2010, both in Ciudad Juarez as well as in El Paso, there were emotional problems found in children that were all living under the poverty level, because that was the target population of the study. And however, on the Mexico side, between 2007 and 2010, which is when the collective violence really started taking hold, there was a significant worsening in emotional problems on that side. However, on the United States, there was not a significant worsening in emotional problems. They were pretty much similar to prior, from 2007 to 2010. Well, the three specific problems that they worsened in were social problems, rule breaking, and aggressive behaviors. Those were all increased significantly after they'd been exposed to the collective violence. So we could possibly attribute that to the collective violence. To begin with, I guess just the exposure to the violence will have a psychiatric and psychological effect on children exposed to it, and acknowledging that is in itself kind of a big hurdle, because I know just in the border area and on that side as well as over here. Psychiatric problems aren't necessarily always acknowledged or really even taken as a health issue. So that's one thing to acknowledge. And then also there is a significant shortage of psychiatrists as well as psychiatric care on both sides of the border. And if problems are recognized within the children, getting psychiatric help, whether it be from actually seeing a psychiatrist or I've actually heard about they had recently started kind of like a internet type of online place where they can get help for the children via, not necessarily even if they can't have actual access to a psychiatrist, something like that. And then also just recognizing even when these children show up for regular health visits, just at a regular checkup, screening for psychiatric problems, and those would all, and then of course, if the violence subsides, that should also help. But in this case, there's nothing that the children can actually do about that. So I guess just staying very aware of if there is a psychiatric problem involved.